And without all the clothes.
Go ahead and sit. So this is fine right here.
We have a classroom full of purrs.
We do.
Not me.
Oh, you're the first one.
Yes. That's fine right there.
Alfred's trying to see here. Over here.
This is easy, and then you rest it on there. But when you collimate more or no?
No.
No? It looks like
You just collimate to the.
I'm gonna tell you right now, dude. The knee does not. It's not right there. It's like, it's messed up. Okay, so try to go like this.
Oh,
Yeah.
Probably need a bigger one, right? No?
That's no need.
Make that bigger one.
Try like that.
How about the sand?
What are you collimating to on that time? Like, what's the collimation?
Ponle la sand.
Just tight.
Just tight.
Yeah. Just lift the color from more. Try that.
That's the right or left?
Left, he said.
Left? That's the left? Here's the marker.
Your nose and swallow it.
Did you remember?
Marker.
Oh, just put it over here.
And it goes face down, the eye.
Oblique, lateral. Now the AP and the oblique, 3 to 5 up. Okay. Lateral, it's 5 to 7. So just keep your rotation at 5. Okay, you got a 8 by 10, 10 by 12. You got both.
No.
Can someone grab an 8 by 10, 10 by 12, and a 14 by 17. Pay attention to the numbers, right? If it's less than 19 centimeters from the ASIS, which is right here, ASIS to the bottom, upper bump. If it's less than 19, you angle 5 caudal. Okay? 5 to 7, or sorry, 3 to 5 caudal. Okay, if it's in between 19 and 24 centimeters, it's at 0. Okay, if it's greater than 24, like most people, then it's going to be 5, 3 to 5 up. So we're just going to keep it at 5. All right, so my epicondyle is going to be parallel to the femur. Right? And we're going to keep her leg straight.
Is yours?
Now, the central ray is going to be ½ inch inferior to the patellar apex. Right? So her patella is right here. You can actually move it. See? So where it sits relaxed, right there. Okay?
The patella moves around?
Yes.
Yeah, it's a
floating bone. Floating.
Which one?
Yeah, you guys can move your patella.
Your kneecap.
Daniel, you know you have one too, right?
Yeah, I can.
He just wanted to touch yours. Everybody has one.
Okay, so we've got an 8 by 10. Okay. You can collimate the length. You want to include, for knees, you want to include as much soft tissue because it is a synovial, diarthroidal joint and it produces a lot of fluid. So whenever it's enlarged or got a lot of fluid in it, you always want to include all the fluid. Okay? Now, for the oblique, right, we can do the internal, right, so internally rotate as much as, okay, if you have to, you can have them move, you know, their body, okay?
Right.
But this is good right here. So you see that space underneath? That's why we're angling it. Okay, now when I do internal rotation oblique, okay, what am I looking at? Same thing as an ankle.
Open.
Open tibio, what?
Okay, so the tibiofibular joint right here, right, with the fibular head is up top, right, is going to be open. And we're also looking at the lateral condyle. It's going to be magnified. Okay, so lateral condyle and tibiofibular joint space open. And also the femorotibial joint. Okay, now you're going to rotate the other way. This way, what are we looking at? Just the medial condyle and the femorotibial joint space. That's it. I need you to turn towards me. So how she has lazy foot right here? You can't have that, so we have to turn her like this. Okay? So epicondyles are, you're gonna flex 20 to 30. Okay, keeps the patient comfortable, and there's no muscle. Right? If she does 90 degrees, you can feel her muscles tighten a little bit more. Okay, so you want to do 20 to 30, keep it right there. Okay. Again. Feel for the condyle, right underneath it.
And this is lateral, right?
Yeah.
This is lateral. So lateral, 5 to 7, always. There is no measurement. It's always going to be 5 to 7. Okay? Now go ahead and lay on your stomach.
Friday said he's talking about the rotation of the tube, right?
Yeah.
I'm just gonna raise your foot. So put her foot on this.
Bless you.
So good, guys, thank you. So this looks about 45, right?
Yeah.
Maybe 40.
45. Yeah.
46.
Okay, so remember, cap
43.
geometry, what are we looking at?
Space.
The fossa,
Okay, intercondylar fossa.
intercondylar fossa.
Okay, now, the goal that we're trying to do is get our tibial plateaus to be perpendicular with the IR. Okay, so the central ray is gonna go like this, right? And her tibia condyle, or, you know, the plateau is gonna be just like this. So who has a book that we're open to? Turn the light real quick. Okay, so. So, right here, right? So if you look,
About what?
the central ray and the tibial plateau, right? And one of the position parts. Center of the neutroid over the popliteal. Okay, so just right here. Okay, the goal is to go perpendicular with the tibial plateau.
For the joint space as well.
Uh-huh.
And it's 40, so it's 40.
Monday. Tibial plantar open? Yeah.
So because of the elongation, right? Okay, so we have 45 and 45. Okay, so whenever the knee is flexed or the leg is flexed, 40, 40, 45, 45, 50, 50, tube angulation, okay?
And this is set gas where we're at now?
This is camp Coventry.
Kevin Company.
Right, so the cap Coventry is when I'm laying prone
Okay.
and my leg is flexed 40 to 50 with a tube angulation of 40 to 50.
Okay.
Okay? Now we're gonna do the set guess. And now she has really short legs, not like Carlos where we could just set him up on here, right? Now, some people do Okay, because it's okay to be magnified, we're just looking at the patellofemoral space, we're not actually looking at a bone structure, right? We could just lower this. Okay, it's okay to magnify. Hold still right there. If not, we would have to get, maybe the, no, not sponge, the,
Like,
tourniquet. Have her hold it behind her head, you know, grab it and put here, hold it. Right. A lot of times they'll have ace bandages in the room. You know, things that, it can't be that thick. Yeah. Another thing that works is that, really well is that, tube wrap for the fingers. You know, get that, put that, and have them use that. Okay, but it is okay to magnify. All right, so this is the setagast. My leg is going to be flexed 90 as much as possible, right? On your chest, it's going to be 90. Okay. Central ray is going to be tangential, which means skipping the surface into the patellofemoral joint space. Okay. Angulation of the tube is going to be 10 to 15 towards the long axis. Okay? So calcometry, setagast, and now we're going to do the femur distal. Okay? So go ahead and lay on your back again. Again, include as much as the femur as possible, okay? Epicondyle is going to be parallel for the upper, right? So again, I have this set to 7 by 17 because usually what we do is we take a 14 by 17 and we split it in half. Okay?
yes.
You have to do this right here.
Right, so again, mid femur to include the knee. I'm sorry. Alright, so here, again, to include the knee. So actually you want to include, there we go. So that would be the distal AP femur.
Do you want to include like, some of the radius and or the tip and
No.
No, you just want to include the whole condyle to the knee joint only. Okay? To the knee joint only. Okay, so 1 inch below the patellar, just have the cutoff right there. Okay. Now if we're doing upper, it's to include the hip, right? So again, if you internally rotate their leg 10 to 15, you could feel this bone pop out, right? So Chad, feel right here. Okay, push hard. No, right here. Okay, internally rotate.
Oh, yeah.
Feel the bone pop out? So you guys want to come over here and just feel it real quick? So this bone, okay?
Yeah,
Okay, what bone is that?
that's the
Head of the femur.
greater trochanter.
Greater trochanter, right?
Greater trochanter.
Okay, so that's a greater trochanter. Greater trochanter is going to be transverse leveling to the pubic symphysis and to your coccyx. Okay? So,
Can I feel her knee?
knee or greater trochanter?
Whatever you guys are feeling. Oh, okay. I feel it.
Go like this.
Oh, my whole hand.
Yeah.
Okay.
So that bump that pops out.
Go. Oh, yeah.
Okay.
Ew.
So, okay, to include the hip joint is 1.5 inches medial to that, right? So we're gonna pop this out, okay, and then we're gonna include to the hip. Okay. Probably the iliac crest right here.
And this is for proximal. If we're doing
Okay, and you have to keep this rotated.
Now,
Okay, the greater trochanter is in profile, the lesser trochanter is not gonna be in profile. Okay, we're not worried about the condyles being parallel, because we're doing the upper. Okay?
quick
Okay,
question.
now
When
we're
we're
gonna do-
doing that position, do we need to feel for the profile?
Uh-huh.
Or that's how we're gonna perfect it by feeling it?
Yeah, you wanna feel for the bone to pop out.
Okay.
A lot of palpated landmarks in your book are gonna be the pubic symphysis, which you're never gonna palpate, right? So what you're gonna do is that, just do this, because then that's gonna, this is equivalent to the pubic symphysis.
Oh, yeah, we can't violate with that, right?
No. Sometimes when people are wearing, tight clothes, you can see it. If your patient's flexible, you can just get them, right, and just turn. Just like that. Okay? So here we have we can include the knee. Right now, the thing that sucks about this is that you'd have to utilize the whole film to get it, right? So that would be your distal, and then actually,
This is the finger.
yeah, for some people, like doing it like this and doing it crosswise. Okay, 17 by 14, right? Putting the film crosswise and doing that. Okay, depending on how their leg is. Some people can only do it like this, right? Now, if they're like this and their knees like this, you have to get them and rotate them. Okay. Or another way of doing this is go ahead
It's like a four
go ahead and
shape.
lay on your right
A
side.
four.
Okay. The other way is doing it this way. Okay, again. Just like
They
that.
can't do the bending of the
Okay.
knee.
Yeah. Go ahead and rotate that way. Just like that. Okay?
Okay.
And then it's hard, you can't do the upper. The upper, there's a cheap way of doing the uppers, but the real way is how I just did it. That's a real lateral.
First time is the real way.
So. Okay. So again. Distal, including the knee. You guys got it? Okay, so Lou, who are you doing?
I don't know, I didn't